क्योंकि बहुत कुछ मैम ने बताया, एंड दैट्स द मोस्ट इम्पॉर्टेंट पार्ट विच वी कैन डू, द गोल्डन आवर। एंड अगर मैम ने एक मिशन सोच लिया है तो होकर ही रहेगा, मुझे लगता है। एंड वी शुड रियली क्लैप फॉर दैट mission what ma'am has thought of, and a wonderful presentation, everything was covered, and I was given the task how we can make our setup a baby friendly. Okay, so we have to do so many things. We talked about so many things to be told to the mother, but what we should, it's not coming now, it's okay. So how we can make our hospitals baby friendly. So what happened, it was a baby friendly hospital initiative which was started long back in 1980s, and when the formula milk company came into picture, before that no mother was feeding with the formula, and that time this concept came with WHO and all. In India also we started making our hospital baby friendly, where we were supporting the breastfeeding. But later on, what happened, it got diluted, no one took care of it, no monitoring, no evaluation system, so it weaned up. Again now in 2016 and 18, WHO again came and they have really pressurized for us to start a baby friendly hospital initiative.
And this baby friendly week also has come in 2020.
Yeah. So now ma'am, we were celebrating early also, but it came into picture and in focus in media quite late. So then they again came, it was revised again, what are the pitfalls, and the government, they started a MA program in 2016 with the Madhuri Dixit, a brand ambassador. And there in hospital, they have started in government that we have to report the exclusive breastfeeding rate, and when we have to report 1 hour feeding rate, antenatal counseling done or not. Every month we have to give the reports of that. But private sector, we were not able to. So today I'll be telling you what we have to do before getting, and again the BPNI, and like we accredit our NABH labs in hospital, again this is aggregated as a baby friendly hospital, and it's been done by a BPNI and Health Association of India. So I'll be talking about how to get your hospital accredited, and the training program they are only doing. Now we can also start a small, so that we can apply. After doing all these 10 points, we can apply for accreditation, and that gives a really marketing as well as help to the mother and the baby. So I'll be telling you how to get your hospital accredited, but before that, how we can make our hospital baby friendly. I'll be talking about those 10 points, which are of the WHO. So in 1989, it was again revised in 2018, and there were again 10 points. Now we have divided those 10 points into 2 categories. So the first 2 steps are critical management procedures, which our hospital has to do, and the other 3rd to 10th are key clinical practices, which we have to follow. So what is the first step? First is again divided into 3 steps. First is no promotion of infant formula bottles or teats, as well as hospital should have comply fully with the IMS Act, that we should not make our hospital bring, mothers can't bring formula milk in the hospital. That should be the policy. And if we are wanting it for some babies do need formula milk. So there should be a procurement method, from where a central procurement method from where we can buy formula milk, and again we can have to give the audit how much was used for how many babies. We cannot allow mothers. That should be a policy of the hospital. So the standard is, it should be normal procurement channel should be there. They should not display any pictures or name with the formulas. And third, 80% of the professionals working in this hospital, they should know that what is IMS Act. At least 2 things about that: it cannot be promoted, it cannot be marketized. So this all should be a hospital policy. Then first B, again in the facility we should put these all 10 points of WHO and Ministry of Health, that these, which I will be talking about, that these practices are done in our hospital. And where do you think these posters should be pasted?
Outside the labor room.
Outside the labor room, ANC ward, ANC room, NCOPD. And also it's very important to put it in the administrator's office outside that, because unless until they don't know the policy, you can't work anything. So that has to be outside the administrator policy, whether MS or DMS or anywhere, and the mother should also be able to see these 10 points. Then the third is we should establish an ongoing monitoring and data management system. So unless until like we are sending every month how many breastfed within 1 hour, how many antenatal counts. So there are certain criteria which we have to report, and again monitor how many formulas were used, dabbas were used. So this all has to be a monitoring system, auditing and the monitoring system of the hospital. Now the administrator A, the second step is ensure that staff are sufficient knowledge, competence and skill to support breastfeeding. Like in lying down, in cesarean section, in normal vaginal, in breast conditions, if problems are there, they are able to help their mothers. So this should be a staff, should be trained. So these two are the administrators' policy, because they only have to make their staff trained. Now the third is the clinical practices, what we have to do. Like ma'am also said, you also said, it's important. The importance and management of breastfeeding should be discussed with all pregnant mothers and their family. As you all said, golden hour will be wasted if we don't talk about the antenatal period. So third, all hospitals should have an antenatal counseling of the mother, and that we can always do. We all know what to be talked about. Like we can talk to the mother in groups, because if you say so many mothers are there, how can we talk each and communicate personally? So that we can do in groups and or with individual mother. If many mothers do come with some personal problems, so we can talk to them personally also. The fourth is immediate and uninterrupted skin to skin contact. That's really important, and that only supports to initiate breastfeeding as soon as possible after birth. So we do say 1 hour. 1 hour is because the baby is active, baby can suckle, and the milk production can start with the prolactin coming into picture. And we all know prolactin takes 2.5 hours to make the milk. Like अभी हमने खाना, भूख लग रही है और हम खाना बनाना चाहते हैं, कुछ तो टाइम लगेगा हमें. तो अगर हमने वो 1 घंटा वेस्ट किया तो खाना बनना नहीं शुरू होगा, और बच्चा जब भूखा है 2.5 घंटे के बाद, तो बेबी विल बी क्रैंकी, एंड नो मदर विल लाइक टू सी द बेबी क्रैंकीनेस. सो दे विल स्टार्ट गिविंग समथिंग फॉर्मूला. सो इट्स ऑलवेज टू स्टार्ट ब्रेस्ट फीडिंग or to start production of the breast milk, we have to use this 1 hour. And naturally you can see the baby is on the chest of the mother. All have seen the breast crawl film?
Yes, yes,
everyone?
Yes.
So it's a beautiful film in which the mother herself, the baby herself reaches to the breast. If time permits, we'll have tea, then I can show you again. Now the fifth step is mother should be supported to initiate, as I said, maintain and tackle breastfeeding conditions. So they should be able to breastfeed, they should be trained, as well as they should be able to help in any of the condition, like giving the latching position, attachment, then breast conditions like inverted nipple, mastitis, like she wants to feed in lying down position after cesarean, or she's so tired she doesn't want to get up and feed the baby, she can feed in the lying down position, and the people should be there to support these things if mother wants, because we want mother to feed any of the position which is comfortable to her. Then the sixth step is no food or fluids other than breast milk unless medically indicated. So how we can give it? We can express it, and then we can give it with the cup feeding. Many times we say we can give with the spoon, or we can, but what happens if we are not giving, or bottle can be, some mothers do come to me, I'm expressing, doctor, I'm giving my own milk, but I'm using bottle. So if I tell them no, bottle will cause, like we say, it will cause infection, it will cause this and that, they come and tell me, no, I'm washing it, I have read in all Google, I'm washing it so many times, I'm sterilizing it, I'm washing my hands, I'm doing this and that. So what I have to say, the bonding will be less, the IQ level, the cognitive power will be less if she's not directly breastfeeding. That is the benefit of breast milk. But breastfeeding benefits are little different than the breast milk things. And secondly, what will happen if she is giving with the bottle, there will be nipple confusion. The baby को कभी तो बना बनाया खाना मिल रहा है और कभी उनको इतनी मेहनत करनी पड़ रही है, तो कभी भी लैच नहीं करेंगे बाद में, तो the baby will go into bottle feeding only. The baby will not come back into the breastfeeding. And spoon say, and that's why if we are feeding with that spoon or we are feeding like that, that also we pour. So again the baby is not getting that. But if we do with the cup or katori directly, then baby takes the milk with the tongue, and the same movement as with the breast. So I can show you the film what we are giving in our nursery, the way we are giving with the katori only. Then again everyone talked about that mother once delivered, they should be first, previously we used to say rooming in, but now we say bedding in. So it was said that the hypothermia won't be there, skin to skin reaction will be there. But one more thing very important with the bedding in is, see what is happening. When the baby is hungry, he is stirring his face. Clues are there. So mouth opening, turning towards the breast, turning ahead. But what happens if the mother is there? The baby is with the mother. Mother will know this clue and she will immediately put the baby to the breast. But if it's with the Mataji, what she is only cradling and जब बिल्कुल रोने लग गए बच्चा तब माँ को देंगे. So क्या होगा कि एक तो frustrated baby है and that latching will be difficult. And every family member will say तेरा बच्चा बहुत रोता है ना, इसको दूध ही नहीं मिल रहा पूरा, तेरा बच्चा बहुत रोता है, इसको दूध ही नहीं मिल रहा, कम आ रहा है दूध तुम्हारा. बट क्या है, पहले तो रुला दिया उनको घुमा घुमा के, तो पहले तो माँ के पास रहने दो. तो जो बच्चा माँ के पास रहेगा और माँ क्लूज देख के इमीडिएटली उसको फीड करेगी, वो बच्चा रोएगा नहीं. एंड एवरीवन विल से कंटेंटेड बच्चा है, पूरा दूध मिल रहा है, रोता भी नहीं है. सो दैट्स ऑल्सो अगेन वी हैव पुट इनटू दिस 8th step of our helping, that will support mothers to recognize and respond to their infants' clues for feeding, which was not there in the this 10 steps. I was a part of WHO for revising these 10 steps. Then the 9th step is, previously we were not saying that we will give negative messages like bottle feeding is bad or something. Now because so many people are doing it, and many of the mother in the Western country, they are coming and they are opting for breastfeeding. No, I am not wanting breastfeeding, I want bottle feeding. So they have again said that we will counsel them about the disadvantages of the breastfeeding, which we were not talking. So in our hospital also we have to, if we want that to be baby friendly, we have to talk about that the dangers and risk of bottle feeding, teats and pacifiers, which we don't talk. We always talk about the advantages only. And the 10th step is that we have to coordinate our discharge. Many times we should know where she can go. If in our hospital we have for 2 days, okay, she was exclusively breastfed, we have started within 1 hour, again she will have many problems. So again we have to guide her where she can go after the delivery, which place in the community, ashas are there, Anganwadi workers are there, or any consultant or any lactation consultant is there. You always tell them to go to them if having problem, because they feel बच्चे को दूध पिलाने का क्या है, माता जी भी कहेंगी नहीं पी रहा है एक बोतल दे देना, कहाँ इतनी दूर जाएगी, अभी तो डिलीवर हुई है. बट फॉर एंटीनेटल एंड फॉर डिलीवर्ड postnatal she will come to you, but for the baby they are not ready to go. So that we have to enforce them at the time of discharge. Now I was talked about कि training हम कैसे कर सकते हैं. तो अभी जो हमारी, so how to train our health professional about breastfeeding. So WHO had a course 3-in-1 which was IVCF and HIV. So we were talking about the complementary feeding, the breastfeeding and the feeding during HIV, when the HIV came. But now WHO is not doing anything because they have, because BPNI has taken over, and we had made a different modules where we do a 7 days counseling, lactation counselor course, and national trainers are made in 13 days. So what happens, 7 days they have to do the counselor course, then they have to do 6 days training in front of us, the national trainer or the director, and then 7 days they have to again teach to the 24 part. 1:6 ratio is there because we want to work in a small group with the mothers for the counseling. And again now, since the baby friendly hospital initiative has started, we had started 2 hours training for 10 days because the hospital people said we cannot come for so many days, and the COVID was also there, so it was online. And then the hospital was accredited. As I'll be talking about who is accrediting and what is the advantages of that. And Government of India, again, MA program is there. We are training them for 4 days. Aapke Swami Dayanand mein to we do it, and I'm doing in my hospital also. So Bisht is there. So he was trained by me with WHO. So these are the training which are running at present. WHO is not doing. Here also we are doing 4 in 1. So यहाँ पे हम breast feeding, complementary feeding, and HIV feeding, and growth monitoring. But with the accreditation of the hospital, we have only focused to the breastfeeding only, not complementary feeding, only breastfeeding with all the 10 steps to be fulfilled there. So this is nothing. So this BPNI with Association of Healthcare Providers in India, they joined hand for the implementation of the project that focuses mainly on the private health facilities. And it is based on the MA program which they are doing in the government, because the private sector was really neglected in that field. So there we were giving, to give the breast feeding and skin to skin contact within 1 hour of the birth. The center is hosted by BPNI, sorry. This is objective we all know, to improve early breastfeeding rate, monitoring, provide award certificate accreditation. MA program, which hospital, the hospital which is doing the best program, they are awarding them something. So this is award creation. We can give the certificate to that hospital that all the things are being run there. Then digital portal and database of such hospital, and then reassessment for 3 years, after 3 years. And here we are providing the technical advice also to the hospital. If they need we want training, or we are lagging in this this aspect of the breastfeeding, so they are giving the technical advice also. Again, following all 10 steps, this are also in Hindi. These are the supportive partners for this thing. So इसमें क्या करना है कि एप्लीकेशन टू NAC देनी है, एंड इनका पेमेंट है, फिर सेल्फ असेसमेंट फॉर्म, इट्स नॉट दैट इम्पॉर्टेंट. सेल्फ असेसमेंट फॉर्म में हमें 20 इंडिकेटर्स हैं जिसको भर के देना है कि हम अपने हॉस्पिटल को एक्रीडेट करना चाहते हैं. तो उनका एक फॉर्म है, उसमें 10 हमें इंडिकेटर्स लिख के देने हैं. इफ़ वी आर डूइंग इट, देन समवन विल कम and if we will see if it's 50% fulfilled, then your hospital is ready for accreditation. Otherwise, the external assessor will come to that hospital and that will accredit for 3 years. And if it's not there, so anywhere in those indicators, if we find any problem is there, we are ready to give the, like record maintaining, data maintaining, like training of that personnel, whatever they feel like. So that technical advice has been given by the BPNI. So then they are giving this breastfeeding friendly hospital a certificate accreditation, and it's by all UNICEF and WHO. And the benefit is only for the mother is that highest quality of care. Now we talk about quality care, we don't talk about the just care. So they are giving the highest quality care, best quality of the nutrition. And hospital has continuous improvement because every time they are monitoring, they've been monitored, so they want better rates next time. Then commitment to quality care and raises the community's confidence in this hospital. That okay, this is baby friendly, like mothers are coming. Like Cloud9, why mothers are coming? They know they are much better maternity facilities, breastfeeding is there. Similarly, the hospital which is accredited, they can really market their hospital that we are giving quality care, and in the breastfeeding support system is there in our hospital. So again, the staff has continuous learning, leadership, ownership, and stimulate quality improvement. And it is helpful in marketing also. So this is the portal platform where we can apply. So many hospitals in Chennai, Telangana, and one Chhattisgarh, I had gone there. That also, this, which place, जो भी खड़ी हुई है, गोरखपुर also I had gone, भूल गई. तो वहाँ भी तो अभी accreditation नहीं हुआ है, but after that training course we do a clinical 2 days clinical training with the mothers. So how to counsel, how to initiate, to show them. So that after that the external assessor goes and then sees that they will say कि अब हमने technically sound हो गए, now we want the accreditation because we have improved those things. So then again the assessor goes and then they accredit that hospital. So positive results are successive monitoring is there. Sorry. Skilled maternity staff is there, successful skin to scan हो जा रहा है, exclusive breastfeed increase हो रही है, antenatal counseling बढ़ जा रही है, and assistance of mother at the time of birth initiate establish breastfeeding, and that's why they are able to do the all 10 steps in their hospital. Because ज़रूरी नहीं है कि हम अभी ही कर पाएँ सारे 10 steps. We might need some technical expertise, some help over there. But if we want, you don't need any technical support. If you think we can maintain all 10 steps, our people are trained enough, then you can, like we were thinking, ma'am is saying, we can start a training program of our own so that if our hospital are capable of all the training, they are ready to do all the 10 steps, then they can apply for accreditation if they want a NAC accreditation and for the improvement of the quality. So this is their contact detail. So every mother should be helped to breastfeed to let her baby say, Mama, you are exactly the mom your baby needs. Thank you.